Welcome everyone to the Apothecary Tales, the basics of pharmacology. Today we're going to talk about the mucormycosis, the dangerous black fungus. So now we can hear this everywhere in most of the post-COVID patients. So today we'll understand what is mucormycosis. Mucormycosis, which is also known as black fungus, is a serious but rare fungal infection that is usually caused by a group of moles known as MUCORMYCOSIS. Now, your doubt must be how dangerous it is, how to get prevented from this. But you have to understand that these moles live throughout the environment. And this mucormycosis usually happen in individuals who have got certain health problems or take certain medicines that would actually lower the immune system of the body. These mucormycosis are usually found common in the environment such as in soil, plants, manure or the decaying fruits and vegetables. So someone with a poor immunity, when they are exposed to this mucormycosis, they get this mucormycosis infection. Now let's understand who all are at the risk of developing the mucormycosis post-COVID-19 infection. Usually, the presentation of the symptoms happens around third week of onset of symptoms associated with COVID-19, and they usually affect people who have got diabetes because the hyperglycemia due to uncontrolled pre-existing diabetes will increase the chances of developing the mucormycosis. At the same time, the rampant overuse as well as irrational use of the steroids, which are immunosuppressants, will reduce the immunity of the COVID-19 patients. As a result, they become susceptible for developing mucormycosis. And indirectly, we know that these steroids cause hyperglycemia over the period of time. So this new onset diabetes due to the steroid overuse or severe cases of COVID-19 is also one reason contributing to the development of mucormycosis. The other factors include prolonged ICU stay as well as the irrational use of broad-spectrum antibiotics, and in those individuals who have got pre-existing comorbidities such as certain hematological malignancies or those who are using certain immunosuppressants or those who have undergone certain solid organ transplant. As well as certain breakthrough infections in patients on voriconazole prophylaxis can also lead to the development of this particular infection. Now, how is it manifested? How do we actually identify this in a patient? This is usually characterized by facial pain, fresh onset of headache post-COVID infection, nasal or sinus congestion, as well as certain black lesions on upper inside of mouth, pain in eye, loss of vision. So it is important to watch out for these signs and go for the appropriate management. Now let's just quickly go through the do's and don'ts of this black fungus. Do's include the monitor blood glucose level post-COVID discharge in diabetes, control the hyperglycemia, use steroid rationally, use clear sterile water for humidifiers during oxygen therapy, use antibiotics or antifungal judicially, use masks and maintain personal hygiene. Now what we shouldn't be doing? Don't miss any warning signs and symptoms. Don't consider all cases of this blocked nose as cases of bacterial sinusitis, especially in cases of immunosuppression or in the COVID patients who are on these immunomodulators. Then don't hesitate in seeking aggressive investigations as appropriate for detecting fungal etiology. Don't self-medicate, especially don't take steroids on your own. Don't lose crucial time to initiate treatment for mucormycosis. So this is a brief idea regarding the mucormycosis and its signs and symptoms. So regarding its management, we'll be talking about in the next video. So stay tuned.